Hello, my name is Mazvita Rankin. I am a St. Joe's graduate of 2010, believe it or not, 12 years.
Mhm.
I currently work at the Children's Hospital of Philadelphia as the Global Health Grants and Program Manager. So, as the Global Health Grants and Program Manager, I support doctors at CHOP as well as other fellows and residents who are interested in global health programs and initiatives to search for, prepare, and submit proposals for funding to create programs that really impact and improve the lives of children, particularly in low and middle income countries. And then I know some people might be surprised to learn that CHOP has a global presence, and so, our center is basically the place where we extend CHOP's mission of providing the best pediatric care, and expanding that beyond the borders of, Philadelphia itself and into other countries as well. Another part of my role is that I work closely with our program director to build and maintain relationships with our partners in different low and middle income countries. And that includes places like Botswana in Southern Africa, Cameroon, Ethiopia, Ghana, as well as South Africa. And so each of these partnerships is us wanting to meet our partners where they are and find out how we can help them care for the children in their countries. I used to like laugh every time people came and gave career talks and we were like, oh, it's not a career ladder, it's a zigzag. And I'd be like, "Ah, they just say that." But to be honest, it really is. And so for me, I'd have to, take us back to my time at St. Joe's. When I came to St. Joe's, I actually was an international student moving from Zimbabwe, to a different country. And so I was, on the biology undergrad, on the med school track. And, after a few years of like working toward that goal, and then just realizing just how challenging it was, both financially as well as just, with the amount of work involved, I really realized it wasn't the path for me, and therefore I pivoted, and I ended up in taking a master's in public health degree at Thomas Jefferson University. And when I was at Jefferson, the program at that time didn't have specific tracks either, but I knew I really wanted to end up in maternal and child health, and so I sought a mentor. Within Jefferson, and I found a physician who worked in the obstetrics and gynecology department to be my mentor. And I ended up doing my capstone project on examining the impact of partner support on maternal health during pregnancy.
Mm.
And so that really, I think was what caught the eye of the recruiters who really recruited me. And I ended up working for a maternal and child health agency that's based here in Philadelphia called the Maternity Care Coalition. And then in that work, it's a nonprofit, and usually it's short staffed a lot of the time. So they quickly put me to work, and noticed that I was really good at writing. And so my manager at the time was like, "Oh, our fundraising team needs help. We're planning a big event, but we also need to apply for this grant. Could you, work on the grant proposal?" And so I started working on that grant proposal. They were impressed with the product. We actually did get funded on that grant. And so that kind of was like the way I entered into global health, global grant writing work, actually. And from there, I started sort of having a dual role. Like initially, I was supporting our chief executive, and then also working with that fundraising team. I ended up being promoted again and worked for our early Head Start program, which supports families of children under the age of 3. And that's a federally funded program. So I had to quickly learn about the federal funding process and again, how to apply for the federal grants. So this was just building onto my knowledge of grant writing as well. And later on, I moved to Boston and worked as a grants manager for a rape crisis center there. Eventually moved back to Philadelphia and was lucky that a friend of mine at that time was working at CHOP and, recommended that I apply for the a position with the Global Health Center at CHOP. And so I'd say for me, my journey has been a combination of like having the educational background, and then as well as working in an organization that enabled me to try different things that, that wasn't what I thought I would end up doing, grant writing. But now I have a niche area within healthcare, and for me, that feels really rewarding as well. So that's how I ended up as a global health grants writer. Would definitely say, in the title of my position is the writing part, and that's a really critical component of the work that I do. But I'd say, in addition to writing, it's also, communication. So I remember that at St. Joe's, like everybody's required to take the English classes, you're required to take theology classes, you're required to take philosophy classes. I think all three of those areas really were areas where you had to write a lot, read a lot, and it helped me develop my skills of how to craft compelling essays, compelling arguments, which is, the skill you need when you're advocating for a program and asking for funding to support the work that you do. And so, I think those really were the foundation of the skills that I developed at St. Joe's, and as well as, that what comes hand in hand with the writing is being able to communicate, especially as I work to manage the relationships that I have with people in different parts of the world, different settings. They each come with different cultural contexts that you must be able to understand, decipher, and in order to work together to achieve a common goal. So I think those were the really big and critical skills that, sometimes you might overlook, like, oh, I have to take this class, it's required. But for me, those required classes were, I think, very foundational for the skills that I developed. I say the different activities, one of them is being able to read a lot. You need to like learn a lot about the world around you, learn about, whether it's here in Philadelphia, understand the real community that you live in, understand the things that are happening within the region, and also be open to, reading news about the world. Like there are opportunities there in understanding what's happening beyond our local area. But in terms of activities, I would definitely say I would encourage people to look for summer internships or volunteer opportunities that allow you to explore different aspects of the field that you're interested in. I know when I was a student, like I said, I really had a narrow focus of like, I want to be a doctor. Therefore, these are the things I need to, volunteer for or show on my CV that I've done. And it is always fantastic to have a goal like that, but also be open to experiences that might be a little different from what you were planning, because they could also open the door for, careers or opportunity you were never thinking of. Like it wasn't on my radar that I would end up working in global health. And, but it was like little experiences that built up until I was able to, carve out a career in global health. So I definitely think volunteer opportunities, internships that, allow you to explore the breadth of opportunities that are there. For networking tips, I'm an introvert. So I will say, I will give these tips from the perspective of an introvert. People really love going to conferences, shaking hands, meeting people. For me, I find that really challenging. And so what I've leaned on was, again, thinking of those volunteer opportunities or internships as an opportunity for you to actually work alongside people who might have the potential to hire you or have a network that could be beneficial for the career path that you're interested in. Because in an internship or a volunteer opportunity, those people have an opportunity to like really observe your work ethic. How well do you interact with others? How good a job do you do at receiving feedback, and can you improve after you receive that feedback? Those are like critical things that will happen when you actually work. And so it's a little glimpse of how you would act And then those people feel more comfortable vouching for you with their colleagues to say, hey, I saw this person, they interned for me or they worked for me, they were excellent. It's better than if I just met someone at a conference and I'm like, oh, you seem like a bright young person, sure. But when I have to like write a recommendation or send up an email to introduce you to someone, having at least observed a little bit of your work product or worked with you and seen what you do, that goes, I think, a longer way than just regular coffee chat or meeting someone at a conference. So for me, I guess I would not call them barriers per se, but maybe challenges. I mentioned again that I was moving from a different country to the United States, and so there was a lot to learn when I was at St. Joe's, as well as in my early career. How do you participate in a class is different from how I had ever participated in class and interacted with my teachers or professors. How do I create a resume? I grew up with people who made CVs, but the US requires a resume. So there's a little like nuanced things that, I had to learn quickly. But I am really fortunate that I had a great support network of professors within the biology department at St. Joe's. I would like to shout out Dr. Clint Springer. They were really great advocates helping me navigate and understanding that I, might need extra help or connecting me to the teaching assistants within the department. All that made a difference in really quickly learning about working or being in the United States, which was different from what I'd grown up in. So the biggest takeaway from me for that was that always be willing to ask for help. If you're struggling or tackling something new, it's never a sign of weakness to reach out. It saves you time rather than trying and trying and trying and hitting your head against the wall. Ask people who've been there or know a bit more about it, and then you're able to overcome whatever challenge or barrier and move ahead with your career as well. So I guess I read this book this year, and I wish I had read it earlier in my career. I would recommend the book Mountains Beyond Mountains, written by Tracy Kidder, and he spent a lot of time working and living with the late Dr. Paul Farmer, who was a global health giant. And Dr. Paul Farmer, his ethos was that every person deserves great health care, no matter where they are born. It shouldn't be a matter of like we're taking resources from one person to give to another person. It should be that everyone has that basic access and deserves that health care. And so to me, reading that book and understanding, that ethos is really meaningful if you want to pursue a career in global health at all. I wished I had known then, or someone had told me that having a plan and a goal is excellent, and you should have something you're working towards. However, you should also allow yourself time to try new things. And it really resonated with me when I was talking to a colleague this year who works at CHOP. She's been at CHOP for over 30 years. And she was telling me, she's like, do you know when I started here, the job that I'm currently in didn't exist, you know? And so sometimes I know we've all gone through the pandemic, the world is different, and there are jobs that didn't exist before the pandemic, but now exist. And so I think don't limit your vision. Always have a plan, but don't limit the vision or your potential for what you could do with your life and your career, because sometimes those jobs or those opportunities might not exist today, but they will exist in the future. And so always leave room and opportunity to explore new things as well.